Thank you, Chair, and thank you, Secretary of State, for joining us today. I just want to ask, going back to talking about the coronavirus pandemic, and I want to know, has the government made any assessment of why more men are dying from the virus than women?
So I thought I'd make a video about the current focus of the UK Parliament's Women and Equalities Common Select Committee, because I think they can teach us a valuable lesson about some of the attitudinal and structural barriers that negatively impact on anyone in government or Parliament, for that matter, concerned with addressing issues such as the male suicide epidemic, boys' consistent underachievement in education, and protecting vulnerable children of both sexes from domestic violence and neglect. Criticism about the creation and maintenance of such unhelpful, unnecessary and frankly discriminatory barriers is most commonly directed towards MPs who stand on the left of the political ideological spectrum. And in fairness, I do think it's fair to say that for a long time the left have very much dominated and driven the direction of travel when it comes to matters of equality discussed and prioritised in Parliament. But then again, I also think that all members of Parliament have to take collective responsibility for any obvious matters of equality that they collectively pretty much ignore, especially members of Parliament who sit on cross-party committees with very double-speak sounding titles such as Women and Equalities, and yet fail to point at the most obvious elephant in their room. And one of the reasons I think it's worthwhile spending some time with this particular committee is that the three members of Parliament I'm going to single out for a particular criticism would all generally be perceived by the general public to be right-wing MPs, being as they are all members of the Conservative Party, and in one case even a member of Her Majesty's current government, who, in my humble subjective opinion, are the group of human beings that must take most collective responsibility for allowing such blatant structural or institutional discrimination to continue on their watch. And so, before we get into the actions or inactions of this committee, let me just say that the main thing I'm seeking to highlight is just how discriminatory the UK government's current arrangements for addressing discrimination currently are. And therefore, in all fairness, any implied criticism of MPs like Carolyn Noakes, the chair of the Women and Equalities Committee, Elizabeth Truss, the government minister for Women and Equalities, and Kemi Badenoch, Minister for Equalities, alongside the unelected and brilliantly titled Minister for Women, Baroness Berridge of the Vale of Catmouse, should be tempered by the reality that inequalities disproportionately impacting on boys and men, like suicide, educational outcomes, and Covid-19 mortalities, aren't actually part of their actual job descriptions, which does to some extent explain why such matters so clearly aren't on their current list of things to do. And I guess to a slightly lesser extent, the same caveat could apply to Nicola Richard and her not especially robust intervention on behalf of the male constituents of West Bromwich East. Anyway, I appreciate this introduction may get a tad confusing or long-winded, but please bear with me because, in my humble subjective opinion, the very visual example I provide at the end of it will make the current problem crystal clear. So, for the uninitiated, the Women and Equalities Committee are a cross-party committee of MPs established in 2015 to scrutinise the government's track record on equalities and specifically to examine the expenditure, administration and policy of the Government Equalities Office, who in turn, amongst other things, are responsible for funding the work of the Equality and Human Rights Commission. The Equality and Human Rights Commission are the non-departmental public body responsible for the promotion and enforcement of equality and non-discrimination laws in England, Scotland and Wales, and accordingly they are the independent watchdog with the lead brief or responsibility in these countries to promote and enforce equality and non-discrimination for and between all protected groups. Protected groups such as boys and men. So, if you've ever found yourself asking the question, who is it that watches the watchman, or watch people who act as the watchdog for equality in this country, then to a very large extent the answer is the Women and Equalities Committee, an oversight process which has led to the occasional toe-curling moment when the Honourable Member for Shipley has been on watch.
So could you tell me what the gender, disability and race pay gaps are in your organisation?
Not off the top of my head, but we'd be happy to provide the information to you separately afterwards. I would just like.
Well, if this is such a priority for the to eliminate these pay gaps across the country, and that you're striving to get all these organisations to take this seriously, you'd think that you would at least know what yours was off the top. I mean, you'd think that this was such a priority. The first thing you'd be doing is keeping a track on exactly what's happening in your own organisation, rather than having a sort of a.
One of the reasons that we're not.
You should know these things for your own organisation off by heart. Surely, if it's that important.
We know. So let me answer the question. I think we know that we have perhaps a small pay gap. I don't know the answer, but I think I would pray and aid the fact that we are actually going through a huge reorganisation at the moment, and in relation to that reorganisation, we're hoping to eliminate any pay gap whatsoever. And as Rebecca has said, we will, once that new operating model has been implemented, provide you with full details. But we should be an exemplar organisation. I completely agree with you. And I think we'd be unique if there wasn't a pay gap, but I would hope that we could eliminate it as much as possible.
Well, let me help you out.
Okay.
I mean, I've got the last figures for which I have, which are for March 2015. So I appreciate that we're a bit out of date with the last figures that seem to be available that I've got. But you had a gender pay gap of 1.2% for full-time workers and 6.8% for part-time workers. You had a 13.3% pay gap for disabled people, so you were paying non-disabled people more than you were paying disabled staff. And you had an 8.8% pay gap on race. So my point is, if an organisation like yours, which has got as its top priority to stamp out these pay gaps, if your organisation can't eliminate these pay gaps, how on earth can we expect every other organisation in the country and every other employer in the country to have eliminated these pay gaps? And just finally, if I might, Madam Chairman, I just wondered how many complaints you'd had, say, over the last, since you'd come into being, by members of your own staff for race discrimination, sex discrimination and disability discrimination. How many complaints have been made by your own staff to you as an organisation under those discrimination headings?
As an organisation, or as
yes, as an organisation. No, as an organisation. Since you've come into.
I don't know. I'm happy to find out and let the committee know.
Well, again, you think you know these things. You're supposed to be there to stamp out any kind of discrimination in the workplace, and you don't seem to have any handle as to how many complaints you have in your own organisation about these things. It seems bizarre to me.
Sorry.
Anyway, one significant fact about both the Minister for Women and Equalities and her Government Equalities Office is that their remit is significantly more narrow than that of the Equality Watchdog. They pay to keep watch on the rest of the country, and in general relates only to women, sexual orientation and transgender equality, which is why their current priorities include plenty of things to do with women and girls, and absolutely nothing to do with boys and men. Indeed, you may be surprised to know that the Government Equalities Office has relatively little to do with matters concerning race and religion and even disability, because they are, in fact, the lead responsibilities of government departments reporting to this minister and this minister, respectively. Now, I appreciate that this is all starting to get a tad confusing, but please bear with me because I'm about to get to the point. Because my point is that no one anywhere in the UK government currently has a responsibility to monitor, act on and speak about equality matters impacting on the 49% of the UK population who are not women or girls. Which is why no less than 3 of the Men and Boys Coalition's current top 10 policy actions that they're asking the government to implement specifically relate to this quite remarkable gap in oversight at the heart of government. And of course the very real structural barriers it creates for anyone in government or Parliament for that matter concerned with addressing issues such as the male suicide epidemic, boys' consistent underachievement in education, and protecting vulnerable children of both sexes from domestic violence and neglect. So, by way of example, because there is no one in government specifically tasked with the responsibility to watch over the UK's equality watchdog to ensure that they are affording fair and equal regard to boys and men, there was no one in government with direct responsibility to challenge the accuracy of a claim made by the chair of the Equality and Human Rights Commission when he recently wrote to the Prime Minister to highlight a range of human rights and equality considerations in relation to the coronavirus pandemic. Specifically, his claim that domestic abuse is a crime that mostly impacts on women and girls. Because, as I highlighted in a recent video, not only did the UK Statistics Authority recently conclude that a very similar claim made by the Minister for Safeguarding may imply that a larger proportion of domestic violence victims are female than the statistics actually show, but government statistics most definitely do not show that domestic abuse is a crime that mostly impacts on girls under 18 when compared to boys of the same age. Now, in fairness to the recently appointed minister with lead responsibility for matters of equality, she has recently announced plans to create an equality hub under her oversight, which will bring together work directly related to all equality groups under one roof, which provides her with the perfect opportunity to implement the Men and Boys Coalition's perfectly reasonable requests. And in fairness to the even more recently appointed chair of the Common Select Committee for Women and Equalities, her committee has reopened an inquiry into the mental health of men and boys, which shows that the committee's current purview and perspective isn't exclusively gynocentric. But, as you're about to see, the Minister's exclusively female equalities team and the committee's almost exclusively female membership still have their work cut out for them if they're remotely serious about putting our money where their mouth is and promoting equality of opportunity for all. So I'm now going to present some edited highlights or possibly lowlights from a recent meeting of the Women and Equalities Committee, convened specifically to examine the potential unequal impact of COVID-19 on people with protected characteristics. For the benefit of anyone with too much time in their hands, I'll post the full 1 hour, 50-minute discussion on my B-side channel, but the good news is I've already watched it, specifically so that you don't have to. And one of the reasons I've made this presentation is because not only does it, in my humble subjective opinion, quite starkly highlight the massive blind spots at the cold heart of the current UK government when it comes to matters concerning boys and men, but it also helps to illustrate just how much the dominant feminist perspective in Parliament impacts on the relative priority placed on people with other protected characteristics. And in this case, most obviously concern for the disabled and elderly women and men that have been a primary factor in the government's quite unprecedented decision to effectively put us all under house arrest. Now, although obviously there was an element of overlap, the meeting can quite easily be divided into 3 main sections of relatively similar lengths. I'm going to focus on the final 2 sections, which most directly address the question of the potential unequal impact of COVID-19 on people with protected characteristics. But to give you a sense of the committee chair's personal political perspective and priorities during a time of national crisis, that is when she's not blaming bald men for keeping her apart from her hairdresser, let's begin with a quick exchange from the committee hearing's first half hour, which involved an interrogation of the relatively recently appointed Minister for Equality's track record to date and the top priorities for her office.
And are we going to see you make an appearance at one of the daily press conferences? It's been really noticeable so far that they have been conducted by men. When's your turn?
The Home Secretary has already made an appearance, as you'll be aware, at the daily press conference. And there's also been appearances by senior medical officials such as Dr. Jenny Harris has appeared at that conference as well. And you'll be aware that women are playing a key part in the response. Therese Coffey, the Secretary of State for Work
Not seen her either, though, have we?
Well, she's done a number of media appearances, and I think she's doing an absolutely brilliant job.
We're not here to talk about what Therese is doing. Are you or Therese going to appear at those daily press conferences?
I was
appearance once by one woman.
I was about to make a point, which is that I don't like tokenism. I don't like the idea that somebody should just appear at a press conference or in a media interview because they're a woman. They should be doing that, and they should be doing the work internally because of the merits of what they're capable of. What I'm saying is the excessive focus on what gender somebody is rather than what they do does a disservice to women, rather than saying that I believe that women are equally as capable as men, that we need more women in politics, that we need to, I think there are opportunities out of COVID to do things like make our parliament more flexible, get more representation. But I think we should be focusing on the right people to present at the press conference. Clearly, the major
not you,
issue,
then? Are you not the right person?
The major issue at the moment is health. And so I think it's right that the health secretary is doing a lot of the press conferences and explaining the specific health issues. I am working, believe me, I'm doing a lot of work, as are ministers right across government responding to this crisis. What's important is the best possible response, because ultimately what women care about, what BAME people care about, what gay people care about is, do we help people stay alive, and will people have jobs and an economic future after that crisis? That's what's important.
And so, speaking of the biggest national crisis faced by this country since World War II, let's now fast forward to the part of the meeting that specifically focused on that subject. A discussion that can be broadly broken into two segments of roughly equal length, one relating to the unequal impact of COVID-19 on grounds of gender, and the other on unequal impacts impacting on everyone else. In relation to the latter, I estimate that approximately 36 minutes were taken up with subjects as varied as elder abuse, emergency changes to the mental health sectioning provisions and the obligation of care on local authorities, the impact of COVID-19 on the LGBT and black and minority ethnic communities respectively, and this rather pressing matter of concern to older people and people with disabilities.
Thank you, Chair. I would just like to go back to Peter's point and talk about whether you share the concerns of disability organisations that the BMA's guidelines for healthcare professionals faced with difficult decisions about who to treat in intensive care could result in discrimination against disabled and elderly people.
Well, we're very clear there should be no discrimination. That is a decision for individuals and their families, and we've been very clear about that.
So what can the government do to ensure that this doesn't happen?
Well, we need to rely on our medical professionals to make sure that is implemented correctly.
And have you a role in this to play? Have you been speaking with the health secretary about this? As you can imagine, when reading the BMA's guidelines, it can put worry in people's minds, especially when they speak of higher survival probability and people may be denied intensive care.
I think the work that the health department has done to increase capacity in the system has meant that we are able to provide everybody with care who needs it. And I think that is absolutely right. In terms of specific conversations, I'm aware of the general issue, but I haven't specifically discussed that with the health secretary because I am confident the advice is very clear that there should be no discrimination.
But before we got into all that, we had the bulk of the approximately 39 minutes exclusively focusing on one primary protected characteristic, namely gender. And refreshingly, the discussion did kick off with a question concerning the minority 49% of people afforded protection on this ground. And to mark this significant moment, I thought it would be interesting to set a timer to record exactly how much time during a nearly 2-hour discussion was spent considering a not entirely insignificant or irrelevant trend.
Thank you. Can I bring in Nicola Richards now, please?
Thank you, Chair, and thank you, Secretary of State, for joining us today. I just want to ask, going back to talking about the coronavirus pandemic, and I want to know, has the government made any assessment of why more men are dying from the virus than women?
We do collect data at present on men and women, and that's already being collected by the ONS and Public Health England. I don't think we do know the full reasons, but that is something that is currently being investigated by the Health Department. And as I said earlier, we're also looking for that other data, specifically on BAME, on the impact on disability as well of the disease. But I think it's fair to say that, across the board, we are working hard to find out more about COVID-19, but it's a relatively new disease and a lot more work needs to be done.
Now, if I was being especially harsh, I might call it as less than a minute, but because of my generous nature, I'm also going to count the next bit, which some of you may consider to be more of a pivot into the longer part of the meeting, which got stuck into all the various ways that women might be seen to be most affected.
Thank you. And so if the government's tracking the number of deaths and infections by gender, which I think is what you've just said, do you know what's being done with this information so far?
Well, the information has been published in its broadest form. I think we're looking at getting the data in a more usable format at the moment. And as you rightly point out, just finding out why it is.
A large majority of the health and social care workforce and are such likely to be at much greater risk of exposure to coronavirus. What is your role in understanding the potential differential effects on the virus on women as well?
Now, I should say that I personally support the logic and purpose of considering the potential impact of a global pandemic from the perspective of various different protected groups. For example, although no one mentioned it during the meeting, pregnant women have been classified as an at-risk vulnerable group. They should only continue working in public-facing roles if an occupational health risk assessment supports this, and it is strongly advised that this is avoided entirely in the third trimester. So the main point I'm trying to make is that there is literally no one in government currently responsible for pushing any sort of meaningful answer to this sort of question on behalf of boys and men.
Are you able to tell me any steps that you've taken directly so far to protect women in particular?
And so, to summarise, what our time spent with the committee has shown us thus far is that, setting aside the introductory half-hour session, which was predominantly dominated by discussions by and about women, the committee's concern or regard for different types of people protected from conscious and unconscious bias by the Equality Act 2010 could be described as having been distributed relatively equally between concern or regard for women and men, and concern or regard for the other primary protected groupings, particularly old people, people with disabilities, and people from LGBT and BAME backgrounds. Although another more accurate way of presenting the same set of data would be to say that the committee spent 50% of their time talking exclusively about women and less than 2% considering one very significant question concerning the health and well-being of men. In fact, the almost exclusively white Female Equalities Committee committed over 9 times as much conversation to the malleable and relatively mythical gender pay gap, which the government recently dropped from everybody's immediate list of important things to do.
You have stressed the importance of data. Now, given the disproportionate impact and the effect it will have on many women during this pandemic, isn't it particularly important to have gender pay gap data? So even if it had been delayed, would that not have been more beneficial to the government in the long term? And are you not concerned that the blanket suspension of enforcement and the message that sends that you're not taking the gender pay gap seriously?
think the very clear message we're sending to companies is that the number one priority is that they stay in business and they keep people employed. And I think it's incredibly important to recognise that this is a national and international crisis we're dealing with. This is not business as usual. And we do want companies to be able to focus on that core job. I speak to lots of businesses in my role as GEO minister, but also as trade secretary. And businesses are under severe pressure at the moment. I think we need to recognise that. And it's right that their focus at the moment is keeping their business going and making sure they retain those jobs. Because without that, without people having jobs, we will be in serious trouble.
And in my humble subjective opinion, this is a quite startling statistic in the context of the quite startling statistics concerning the unequal impact of COVID-19. Because although the daily data published by the government is still not broken down by sex or gender, data from the Intensive Care National Audit and Research Centre indicates that men make up 70% of COVID-19 patients requiring critical care and 75% of deaths in England, Wales and Northern Ireland. ONS data confirms that younger men under 60 are at least twice as likely to die as younger women, and every single country on the entire planet to publish data broken down by gender indicate that men are dying at significantly higher rates than any other people. And although the Equalities Minister clearly has yet to receive the memo, this isn't just an example of toxic masculinity at play, because it has for a very long time been understood by any medical professionals paying proper attention that there are significant sex differences between the immune systems of people of different sex. Women have 2 X chromosomes to men's 1. And according to the author of On the Genetic Superiority of Women, because many immune-related genes are on the X chromosome, this means that every female has an extra 1,000 genes over every male, available to protect them from nasty bugs like the much-mocked man flu. And according to Philip Goulder, Professor of Immunology at the University of Oxford, not only are women advantaged by the fact that the protein which senses viruses like coronavirus is encoded by a gene that's on the X chromosome, but women's immune systems also respond more aggressively to viruses because women have less testosterone, which is immunosuppressive. Women are in fact 2 to 3 times more likely to clear an infection such as hepatitis C without treatment, and 5 times more likely to be one of the very small fraction of people whose immune systems can control HIV without treatment. Indeed, it has been known that outbreaks of coronavirus have had unequal impacts between men and women, at least as far back as the Spanish flu. And more recently, 74% of deaths recorded globally during the 2003 SARS epidemic just so happened to be men. But never mind all that, let's talk about the potential unequal impact of COVID-19 on people who happen to be L, G, B or T.
The LGBT Foundation and other organisations such as Stonewall have been conducting research on the impact of COVID-19 and the LGBT plus community. And they have suggested that the virus may be disproportionately affect groups such as LGBT plus people who already experience poorer outcomes in healthcare. So we've heard, can you tell us, please, how you've been engaging with LGBT stakeholders, and do you think that there are specific actions that the government can and should take?
Well, in terms of the data, I'd be very interested to see the data you've had and to have a look at that, and we can consider that in the Government Equalities Office. I have, during the crisis, made sure that we have the proper LGBT healthcare advisor in place. I'm sure Helen Cook can give you a bit more detail about that if I hand over to her, but we have been involved with the health department, making sure that LGBT advice is specifically in place to make sure that LGBT people are not specifically in a difficult position because of this crisis. Helen, can I bring you in on that?
Yes, I think that's exactly right. We of course have the healthcare advisor, Dr. Michael Brady, and very good news that we were able to kind of keep on funding him, and he'll be in place for another year now, and he is working specifically on this issue. I wasn't aware of specific data around different health outcomes for LGBT people, so I think we would be really interested to see that. But that work is certainly going on.
Thank you. And as Helen said, we made that decision just as the extent of the coronavirus crisis was becoming clear. We made that decision to fund that from the GEO budget because we thought it was a really important priority early on. And Kate, I can commit to you that I'm happy to speak to LGBTQ stakeholders on this specific issue following this committee meeting. So I'm very happy to talk to them in more detail after that.
Thank you, Secretary of State. That commitment is very welcome.
Now, personally, I don't begrudge the member for Jarrow asking a question addressing such specific concerns, but the point of playing that particular clip is to show that her constituents received an altogether more robust and reassuring response than the one that the Minister responsible for the Office of Equalities had so recently afforded the 49% of the UK population who still disproportionately pay for public services like her.
We do collect data at present on men and women, and that's already being collected by the ONS and Public Health England. I don't think we do know the full reasons, but that is something that is currently being investigated.
And incredibly, on the 6th of May, when the Minister subsequently rose to address Parliament on the impact of the pandemic across protected groups, men only got one tiny blink-and-you'll-miss-it minor mention at the start of a session that largely focused on questions about race.
I am proud that we are one of the leading countries in the world for LGBT rights. LGBT Conference of LGBT People,
LGBT rights,
gay and bisexual men.
We've seen numerous reports that the COVID lockdown is having a disproportionately negative impact on the LGBT plus community. And this is particularly with regards to mental health, domestic abuse and homelessness, homophobia, transphobia and biphobia. What is the government doing to ensure that LGBT plus people are receiving the support needed throughout the COVID crisis?
LGBT people get on LGBT healthcare. All LGBT people are able to secure that support for LGBT people during this pandemic.
All of which brings me to perhaps the most important lesson that I believe our time spent with Carolyn Noakes and her committee of Karens can teach us about the existence of a highly significant and frankly quite remarkable blind spot concerning due regard and compassion for our fellow men. A blind spot that Ms Noakes and her Equality Committee can, in all fairness, only take so much responsibility for failing to find, because it's not just parliamentarians who so frequently fail to see it or are permanently preoccupied with conflicting concerns. Because obviously another highly significant part of the equalities infrastructure that impacts on and influences the direction of resources and focus of departments like the GEO are the myriad of external stakeholders who speak for and loudly lobby on behalf of various particular interested parties and concerns of specific groups. A lobby that by now very much involves ideologically infused influential voices in the media who, in the run-up to our meeting, had begun pointing to a particularly pressing political concern.
I think the real surprise is that anybody is surprised. I mean, if you look at most areas of healthcare, you'll find that there's significant disparities for minority communities. And when we see these things happen and coronavirus happen, we have this kind of idea that the virus doesn't discriminate, we're all in this together. But really, it's just unveiling the true realities of our society.
I think what coronavirus has done is just put a mirror up to society to say that there are all these health inequalities, because we have known about them. In fact, earlier this year, the Marmot report that came out showed that from birth to life expectancy, there's a 12-year disparity and there's a north-south divide as well.
I think there are some uncertainties, and I think that's why we really do need to firm up these data. There's two sort of broad factors, and it might be different in different sort of communities. One may be that there's a social element to this, in the sense that certainly, for example, in the South Asian community, the way they live their lives is much more family orientated. and perhaps the social distancing aspect has been more difficult for them. The second part could be that once they have had the virus, and even for the same level of viral infection, their capacity to perhaps cope with the immune response that comes from the virus is diminished in some way.
Now, Dr. Arif, we tell people over the age of 70 to stay indoors. We tell people with pre-existing medical conditions to stay indoors for longer than perhaps the rest of us. What should you say to someone watching you tonight, watching this program, who is from the BAME community and feels that they're particularly vulnerable? Should there be special measures?
Of course, I think that your report really clearly said earlier that the hospitals and line managers need to be actually talking to their staff and risk assessing those from Black, Asian, ethnic minorities.
Home Secretary, there has been lots of coverage recently about the high deaths of Black people as a result of COVID-19. And the first 10 doctors that died were the BAME community. So what I'd like to know is, how concerned are you about these high levels of deaths?
Well, I'm very concerned to hear these reports, and I've had discussions with the Race Disparity Unit and the Chief Medical Officer in Public Health England about really establishing what the data is showing us about the impact on BME communities of this virus. So we've already started that work. We don't yet have the data to really show us exactly what the situation is or why the situation has come about, but that is something we are certainly working on.
There does appear, as you say, to be a disproportionate impact of the virus upon BME communities.
Now, hopefully members of Black and minority ethnic communities would have been reassured not only by the high degree of concern expressed by the Minister for Women and Equalities, but also by the fact that a number of inquiries have now been launched in relation to the not insignificant data emerging in relation to the unequal impact of COVID-19 on people from minority ethnic backgrounds. Indeed, by the time the Minister for Women addressed Parliament on this matter, the Institute of Fiscal Studies had indicated that, proportionately speaking, Black and Asian Britons were 2.5 times more likely to die from COVID-19 than white people. The Office for National Statistics were suggesting that this could actually be as much as 4 times more likely. The British Medical Association were calling on the government to take urgent action. The NHS had announced plans to risk assess all BAME health workers. And incredibly, both the Royal College of Surgeons and the Royal College of Nurses had called for Black and minority ethnic staff to be removed from the front line. So inevitably, quite a few members of Parliament lined up to have their say.
NHS trusts have reported problems moving at-risk BAME NHS staff away from the front line of the crisis, despite calls from Public Health England to do so.
But there are some things that we can do right now to better understand the disproportionate impact of COVID-19 on the BAME community.
Finally, Public Health England last week have asked all NHS trusts to risk assess their BAME staff and, where necessary, remove them from the front line.
What is the Minister doing to address the disproportionate impact of the virus on BAME and working class communities?
And can I ask her specifically what input the GEO is having into the work of Public Health England? And is she confident that we will not only find out why and how BAME communities are affected, but also what needs to be done to protect them?
Thank you again, Mr. Speaker. We are very concerned by reports of a disproportionate impact of COVID-19 on ethnic minorities. It is important that we understand what is underpinning these disparities and that we have robust and accurate data to do so in order to take effective action.
Now, sadly, there have been attempts in recent times to smear any advocates of men's human rights as essentially dog-whistle white supremacists, and as a consequence, I'm mildly reluctant to step into this particular minefield of complex variables, known unknowns, and confusingly conflicting data. But then again, by now, pretty much everyone to the right of Diane Abbott has at some stage been branded as a literal Nazi, so I may as well just be damned and go ahead and have my say, particularly in relation to an increasingly statistically significant statistic that numerous people have been pointing out over recent weeks, including the chair of the Women and Equalities Committee.
Well, I think it's very worrying that, particularly when you looked at the first 10 doctors who died, they were all from Black, Asian, minority ethnic backgrounds. And I think it's critical that we do the investigations to find out why. But more importantly, we look at what can be done now to better protect those individuals.
And none other than Diane Abbott herself.
Thank you, Mr. Speaker. The Minister will be aware that of the 17 doctors who've died from COVID-19, 16 are from BAME backgrounds.
So, for the uninitiated, an Office of National Statistics analysis published earlier this week has found increased mortality rates due to COVID-19 for all ethnic minority groups in the UK when compared to white people, with the notable exception of Chinese women, and with black and Bangladeshi people found to be particularly at risk. However, the report also flags various variables that still need to be fully factored or properly understood. For example, it's acknowledged that various health trusts have not all been robustly collecting the relevant data as it applies to ethnicity, which means that the current picture is somewhat muddied. It's understood that some ethnic groups are overrepresented in public-facing occupations and are therefore more likely to get infected. Proportionality comparisons have largely been based on population data that is almost 10 years old and is almost certainly an underestimate of the current UK BAME population. This 10-year-old data shows us that black and minority ethnic populations predominantly live in urban locations. So, for example, at the time of the last census, London, which has been worst hit by the pandemic, was the most ethnically diverse region in the UK, with 40% of residents identified as BAME. The Office of National Statistics report that a substantial part of the difference in COVID-19 mortality between ethnic groups is explained by the different circumstances in which members of these groups are known to live, such as areas with socioeconomic deprivation. However, these factors do not explain all of the difference, suggesting that other causes are still to be identified. So in other words, according to the ONS, this slightly muddled and complex picture appears to be particularly pointing to two particular potential things. Firstly, groups such as the race equality think tank the Runnymede Trust are suggesting that this is highlighting the deep and devastating impact that structural and attitudinal inequalities have on black and minority ethnic UK populations. Or as Helen Barnard from the Joseph Rowntree Foundation puts it, it is a stark reminder that although we're all weathering the same storm, we're not all in the same boat. But there is also an increasingly compelling argument to suggest that genetics may also be a significant factor. And this is where those 10 or 17 or at the last grim count 24 doctors become so statistically significant. Because to extend Helen's metaphor, NHS doctors tend to have pretty decent boats.
I think the most difficult thing that we're finding ability to grasp at the moment is the fact that we are getting doctors, healthcare professionals who are meant to be middle class or actually earning a little bit better. And that's what's really thrown everybody. We don't know what the underlying reasons for that is.
So we don't definitely know the underlying reasons behind the quite startling fact that at the last count, 23 of the 24 doctors to die from COVID-19 were BAME. Although, having done a bit of research on the matter, I would suggest that the fact that 15 of them were located in London is certainly a helpful fact to know. And, well, I guess it's not yet entirely beyond the realms of possibility that the Chinese virus that comes from China is literally racist. At the risk of being accused of pushing a supremacist perspective, I'm going to pay my respects to all 24 of those doctors by pointing to the one blindingly obvious reason why genetics could very well be at play.
The factors relating to poverty are not going to be those that are killing doctors, and yet we're seeing they're disproportionately affected. Something like the first 12, maybe more, were BAME.
With a little help from one of the many brilliantly no-nonsense women that thankfully still have men's backs.
Yesterday, the Department of Health put out a tweet saying there's emerging evidence to suggest the coronavirus may be having a disproportionate impact on some ethnic groups as well as certain genders.
Yeah.
Can you tell me?
Men.
Certain
it's
genders.
Men.
Yes. Well, yes.
It's
There's a little bit of a concern that the Department of Health might not know that there are only two genders.
I don't think that. I think we'll be having discussions, but we with the in the department. But there's a it's there are just to the last point, right? Men are more likely to die of this disease than women, and we need to understand much more about why that's the case.
So not certain genders, men.
Men, absolutely, yeah.
Good to know the Health Secretary at least knows the difference, even if some of the staff don't. I think perhaps you might need to have a word with your terribly woke social media team. Why is everyone so concerned about particular groups who are dying of COVID-19 but seem to be completely ignoring the fact that it's largely men? It seems when there's talk about even taking, say, ethnic minority health workers away from the front line, I haven't heard anyone say we should get men away from the front line. They're more likely to die. Why does no one care about men anymore?
Well, I care about men. I care about everyone. But you're right. I mean, it's often men who are more likely to die from heart disease and respiratory disease. Often, when particularly in poorer backgrounds, usually a reflection of the type of work that they have been involved in particularly older men. Often a reflection of the manual labour that they did in their work. So I think these things need to all be looked at carefully and considered. So I think I'm making the point there is obviously biological factors that we have to take into account, but there's also social factors as well, and that's why I think the government needs to review all this properly. But I think it is self-evident that people in poorer areas, in high density urban areas, living in overcrowded flats, damp flats, they need better support, because this virus has exposed the fault lines in society.
And the specific fault line in society that this video is pointing at is a quite remarkable lack of empathy in society for men, especially when directly compared to women, because incredibly 23 out of those 24 doctors also happen to be men. And so in summary, our time spent with the Equalities Committee has taught us that while we can't say with any degree of certainty that follically challenged men are definitely responsible for separating Carolyn Noakes from her hairdresser, we can say that there is significant and increasingly compelling evidence to indicate that people like Caroline Noakes may be psychologically programmed or perhaps even genetically predisposed to ignore highly significant unequal impacts impacting on one particular protected group. Which is why I will be writing to the government's Equalities Minister, compelling her to act on the Men and Boys Coalition's recommendations when undertaking her current work to ensure that the new Equalities Hub at the heart of government is entirely inclusive and fit for purpose. Most specifically, to extend the remit of the Equalities Office to finally include men and boys, and crucially to appoint a special advisor for them within her office. I'll include a link to a template of that letter, and I would encourage you to write to her too. And just before I finish, I think it's vital to acknowledge that one of the most insidious and frankly dangerous aspects arising from the modern day matrix for managing matters concerning people with protected characteristics is the reality that even if motivated by positive intentions, some people will seek to use it to ring-fence unequal power, resources and compassion for their particular group, even if it sometimes involves entirely cutting other people loose. And so whilst I make no apology for focusing on a protected characteristic that is quite literally being ignored by the Government Equalities Office, I also want to take a moment to remember Dr. Mamouna Rana, the first female doctor to die of COVID-19, and people like Onyennachi Obasi, the angel nurse, who sadly passed away recently after expressing concerns about a lack of personal protective equipment available to NHS staff, because obviously their lives were just as important, and mapping inequality is obviously a complex matter. For example, a study by the Health Service Journal examining COVID-related deaths of NHS frontline workers showed that by the end of April, more female nurses had died than male doctors, and that both men and people from black and minority ethnic backgrounds were dying at significantly higher rates when compared to the numbers employed by the NHS. The distribution of deaths by occupation among nurses, support workers and doctors is broadly consistent with employment ratios, but age and country of origin were also identified as highly significant factors. So in other words, it is a complex picture, and it doesn't help anyone if you ignore half the people in it. And what you can do with that picture is obviously another complex matter, because I somehow doubt we'd be celebrating VE Day this weekend if that generation of heroes had decided it would be safer to stay at home. But I'll leave anyone who's watched this far, including hopefully some members of the Equalities Committee, with another thought from the Joseph Rowntree Foundation's Helen Barnard. With the Bank of England now forecasting the deepest recession on record, we must ask ourselves what kind of society we want to live in after the virus passes. As a society that prides itself on justice and compassion, we can and must do better.
Can't you see it too? There's an elephant in the room.